For Men Only, TV9 News Special is sponsored by Mercy Medical Center in Cedar Rapids in cooperation with Lynn County Urology.
Hello, I'm Bruce Downey at Mercy Medical Center in Cedar Rapids. Thanks for joining us. Millions of American men suffer from prostate cancer or prostate disease. That's why we call our program For Men Only. But if you're a woman, this program is really for you too, because your husband, your father, or your brother could be at risk. To find out if someone you know or love could have prostate cancer or prostate disease, please get a pencil and paper together in the next couple of minutes. We're going to be giving you an important phone number. It's one that will help you to register for free prostate screenings here at Mercy Medical Center next week. We'll have that phone number in just a moment. But first, the hidden killer, prostate cancer. Every man is a potential victim, including you. Despite all the publicity about prostate cancer, many men don't know what their prostate is, what it does, or even know where it's located. The prostate is shaped like a walnut, and it's located just beneath the bladder. The prostate produces the milky white seminal fluid that mixes with the sperm just before ejaculation. The prostate is very small, but it can cause big trouble. Prostate cancer is the #1 cancer among men and the second leading cause of cancer death. This year, according to the American Cancer Society, 200,000 American men will get prostate cancer, 38,000 will die. Here in Iowa, the Cancer Society estimates 2,600 men will get prostate cancer and 500 will die.
The incidence of this has been increasing, and there's a couple reasons for that. One is that we're living longer, and this is a disease that mainly affects men as they get older. So it starts in the 50s, but your risk goes on up as you get older. And so as we live longer as a general population, we're going to see a higher incidence. But the other thing that's happened is our ability to diagnose it has gotten better. And around 89 or 90, 2 new tests came online, the PSA blood test and the ultrasound exam, which allowed us to start diagnosing this better.
PSA stands for prostatic specific antigen, and that is a protein that is secreted by prostate cells. That is, the cells in the prostate, and it's specific for prostate cells. That antigen or protein can be measured in the blood, and it can be correlated with the findings at the time of digital rectal examination, so that if the level is elevated and the level is higher than one would suspect by the digital rectal exam, this would then lead to concern that prostate cancer is present.
The one important thing that makes PSA so important in the detection of cancer of the prostate is that cancer of the prostate cells make PSA 10 times more rapidly than the same amount of tissue that would be benign. So you see, a small nest of cancer that makes 10 times more PSA that gets into the bloodstream can therefore allow us to detect a small cancer early in the game.
If you don't think this cancer can happen to you, you're playing a dangerous game with your life. Every man is a potential victim of prostate cancer, especially older men. More than 80% of all prostate cancers are diagnosed in men over the age of 65. But if you have a family history of prostate cancer, if your father or brother had the disease, it doesn't matter how old you are.
The risk is about 4 times greater if you have the family history, and particularly if the father or brother had prostate cancer at an early age, then the risk even is more dramatically increased for the other male.
Family history is not the only risk factor. For some unknown reason, the color of your skin can also increase your risk of prostate cancer.
The fact is that it's not all well, it is all African American men. It's not all black men throughout the world. The highest incidence of prostate cancer does occur in the black male in the United States. we really don't know why that is, whether it's related to person's diet, whether it's related to higher levels of male hormones in the teenage years. There isn't an answer that is definite at this point.
In most cases, doctors recommend you start getting checked when you're 50. But if you have a family history of prostate cancer, you want to start getting checked when you're 40. Early detection is the key to surviving prostate cancer. 4 years ago, Hal Wilson read about Mercy Medical Center's prostate screenings in the Gazette. He never knew he had a problem.
No symptoms, none whatsoever. Nothing. I mean, I was just as healthy as I am today.
Hal Wilson had no warning he had prostate cancer. That's because, unlike other cancers, the early warning signs for prostate cancer don't come early enough.
Oftentimes the warning signs come after the prostate cancer has spread to other areas or has enlarged in the area of the prostate to the point that it's causing trouble. And so those signs basically would be if it is enlarged in the local area, that a person could be bleeding in the urine, could have blood in the semen at the time of ejaculation, could have difficulty urinating with slowing of the urine stream, difficulty getting the stream started, getting up more often at night than usual because of obstruction due to the cancer. Those are usually late findings that occur later on in the development of the cancer process.
That's why prostate screenings like these at Mercy Medical Center are so important. These screenings could save your life. They saved Hal Wilson's life.
Everybody should do it. There's no question in my mind that if you've never had it, and again, they don't know anything about this thing, whether it's hereditary or not, but I think that everybody should have it done.
How important is it that men get these tests every year, the PSA and the digital rectal exam?
At this point in the evolution of prostate cancer, we really don't know how important it is. Part of what we're doing in our screening evaluations, and have been doing since 1990, is supplying data from the men who have gone through these screenings, and we're supplying data to a national database, and this information is being gathered from all over the country, so that ultimately we will really be able to answer the question of how valuable these screenings are in getting rid of prostate cancer, prolonging men's lives who have prostate cancer by detecting it early. So at this point, this information is still being gathered. We have a number of years yet to go to determine the answer to that. At the present time, it's pretty obvious that we have been finding prostate cancer, tremendous numbers of patients, and we have been actively treating many of these patients.
There is no one treatment for prostate cancer. Your doctor may recommend surgery or radiation or hormone treatment or chemotherapy. Different patients are treated differently, and sometimes the best thing to do is to do nothing.
We have two men, and we've evaluated them, and they both have exactly the same degree of prostate cancer. We might tell them two radically different treatment options. And that's a problem with this, and it's not a simple cookbook type treatment. One man may have a radical surgery recommended to him. Another man may have just watchful waiting, do nothing kind of treatment recommended, and that's for the same stage of disease.
If it's caught in its early stages, the 5-year survival rate for men with prostate cancer is 91%. We've said it before, and we'll say it again. Early detection is the key to surviving prostate cancer.
I think this is a reason why we're having this program, that we men must be aware that this little gland can kill us. And so we have to pay attention to our health, and especially our prostate health.
I would say to the women in the community, if your husband is in the age group where screening is recommended, then give a call, pick up the phone and call the Cancer Center and get them signed up for the screening.
I would like to appeal to our patients, the men of Eastern Iowa. Pay more attention to your health and pay more attention to the possibility that your prostate gland, the disease of it, could kill you. So go to your primary care physician. Get that examination once a year, and it may save your life.
Good advice. Now, we asked you to get a pencil and paper together for a very important phone number. It's to allow you to register for a free prostate screening next week at Mercy Medical Center. Now, here's the number, 365-4673, or you can call this toll-free number, 1-800-642-6329. To be eligible, men must be 50 years of age or older, or over 40 years of age if you have a family history of prostate cancer. But you must not have participated in the 1990, 91, 92, or 1993 prostate screenings, and you must not have a personal history of prostate cancer. Once again, the phone numbers are 365-4673 or toll-free 1-800-642-6329. Call now. It could save your life. And stay with us. We'll be right back. Cancer. It's probably one of the most frightening words any of us will ever hear. But if you suspect that you have a problem, or if you have any of the warning signs, it doesn't necessarily mean you have cancer.
That's exactly right. The prostate can cause several problems. The most common problems that we see with guys with symptoms of urination just has to do with the obstruction of the gland. As men get older, the prostate gland normally enlarges. That enlargement can cause blockage of the stream of urination and cause symptoms such as getting up at night to urinate, straining to void, pain or burning with urination.
If the symptoms of benign prostate disease sound familiar, it's because they are. They are the same as the symptoms for prostate cancer. So if you suffer from painful or burning urination, if you see blood in your urine, or if you have trouble urinating or difficulty starting, don't automatically think you have cancer. It could be a less serious condition called benign prostatic hypertrophy, or BPH.
Generally, men in their 60s and 70s are the ones that I usually see for these type of problems. It can start earlier, that's unusual, but most men present about their 60s to 70s with these type of symptoms.
The symptoms of BPH are difficulty in initiating your stream in the morning or during the day, usually in the morning, slow stream, frequency, an intermittent stream, straining to void, and getting up several times a night.
The key thing is a change. If there's acute change in the way you've been having your voiding pattern, for instance, you've been doing well, all of a sudden you've noticed you're getting up at night a lot more frequently, a lot more pain during the day. Sudden changes certainly alert us to something to look into right away. But just overall, if you're having, over a period of years, worsening problems, definitely something to get checked.
This is a mold, the one I took out many years ago, and this is what it actually looks like when it comes out. This is a very big one.
Most of these growths are benign growths. And in fact, the benign growth that occurs within the channel that the man urinates through. And it creates a pinching off effect within that urethral passageway, making it more difficult for the patient to urinate.
Men that have significant blockage can develop serious problems with loss of kidney function, infections, bleeding. Those men we do surgery on to alleviate or remove the blockage. That has a very good response rate and it corrects the problem. There's a vast wealth of men that are suffering with these symptoms but aren't severe enough that it's causing them severe health problems. Instead of putting those guys through something invasive like surgery, we have other means now to help treat these symptoms, to reduce the symptoms, make their lifestyle better, their quality of life improve, with medications.
Two of the most common medicines are alpha blockers and a new drug called Proscar. Alpha blockers relax the opening between the bladder and prostate so men can urinate easier. It is 65 to 70% effective and works within weeks. Proscar attempts to shrink the prostate. It is only 30% effective and may take months to work. But what doctors call the best prostate treatment, or the gold standard, is a procedure they call transurethral resection of the prostate, or TURP.
We have an instrument called a resectoscope. This is passed through the penis, into the bladder and prostate, up the urethral channel like this. It has a loop on the end out here that goes out. It's managed like this. And the electric current cuts the tissue. And then the tissue comes out in little pieces like this, and then it's evacuated from the bladder, and the little pieces are checked for cancer. This procedure has been used in millions of cases, of course, since 1931, and is the gold standard for prostate surgery, and really has not been improved upon or changed or varied in any shape or form since those early days.
But now there is a new state-of-the-art treatment for prostate disease. We'll have exclusive details next. Stay with us. Welcome back. 1 out of every 3 men over the age of 50 suffers from prostate disease. That adds up to millions of American men, and many of them fear undergoing treatment. Well, now doctors at Mercy Medical Center in Cedar Rapids are using new laser surgery to treat prostate disease. And tonight, for the first time on television, you'll see how lasers are lighting the way to a cure.
Since about 1991, a new procedure has been devised with the use of YAG laser, or some type of laser that, so to speak, melts the tissue instead of cutting it.
The procedure lasts anywhere between 20 minutes and 60 minutes.
For more than 60 years, the most common treatment for prostate disease has been transurethral resection of the prostate, or TURP. 400,000 of those operations are performed in the United States every year, and they cost patients more than $4 billion. But the new laser surgery reduces hospital costs and reduces hospital stays.
It is good news for millions of men as well as for the medical cost, because the hospitalization is much shorter, in that the patient can go home either the same day or the following day, and thus does not have to stay in for 2 or 3 or 4 days.
Although lasers are nothing new in the operating room, doctors at Mercy Medical Center in Cedar Rapids have been performing the laser prostate surgery for less than a year.
It basically melts the tissue, or vaporizes the tissue by raising the temperature to over 100 degrees centigrade.
So what you do is you have the scope in here, and then you move around. And
it is basically a procedure for the benign variety of prostatic enlargement and obstruction. It can be used as a palliative procedure for malignant prostates also if there is obstruction present, but it is not a curative procedure for the prostate in the presence of cancer. Obviously, this procedure is relatively young. It is, however, relatively easy to learn, much easier than TURP, because we are quite familiar with the instruments and the technique that is being utilized during this procedure.
The laser surgery has many advantages, but it also has disadvantages.
It is effective. We don't have much experience with large glands, and I'd like to throw in a caution with regard to prostate cancer, in that we do occasionally find prostate cancer with the regular TURP, and then of course need to take some additional steps. The disadvantage of the laser is that the tissue gets vaporized, and we do not have anything to send down to the pathologist to look at under the microscope to see was there cancer present or not.
If you would like more information on this new laser surgery, call Lynn County Urology in Cedar Rapids. The phone number is area code 319-363-8171. Once again, that's 319-363-8171. Stay with us. We'll be right back.
For men only at TV9 News Special is sponsored by Mercy Medical Center in Cedar Rapids in cooperation with Lynn County Urology.
I was just thinking today that we're spending a half an hour discussing a little tiny gland within a very large human body, and think of all the havoc that that gland raises to the American male over the ensuing lifetime of us.
If you're a man, don't take chances with your health, especially your prostate health. Now is the time to take action. If you would like a free prostate screening, call 365-4673 now, or call toll-free 1-800-642-6329. To be eligible, you men must be 50 years of age or older, or over 40 if you have a family history of prostate cancer. And you must not have participated in any of the past prostate screenings at Mercy Medical Center, and you must not have a personal history of prostate cancer. If you would like more information on prostate cancer, plan to attend a special meeting called Understanding Prostate Cancer. The meeting will be Thursday, September 22nd at 7 o'clock at Mercy Medical Center in Cedar Rapids. To register, call the same numbers, 365-4673 or 1-800-642-6329. Call now. The life you save may be your own. I'm Bruce Downey. Thanks for watching.